Alright, so let us discuss a remedy today which is often missed in our clinical practice. The reason is that we are tend to prescribing polycrest remedies. So good to see Dr. Aditi Bansal, Shilpa Dubey, and a few people on YouTube. We are live on Instagram and YouTube simultaneously. And today is another day of Ellen's keynote study streak. So, Muskan Virani, yes, welcome. And we'll have some more people who are regular attendees and who are willing to study and revise homeopathy in a different way or maybe in the same way, but revision is more important. So, this is a remedy which is often missed in our practice because we tend to give importance to major polycrests. But sometimes there will be something peculiar about a polycrest remedy presentation in clinical practice. For example, a lycopodium patient will probably be showing you traits that he is very much forgetful, or he'll show that I feel better in my headache when I'm eating, or there is some gastric symptoms which are disappearing whenever they eat, and he has wart like appearances or eruptions on the face, on the body parts. What will you prescribe? You are giving lyco, then you will give thuja, lyco, thuja, lyco, thuja. The patient feels better, 80% doesn't get well. That is where you should think of a remedy which is anacardium. Let us discuss today. It is a remedy from the Anacardiaceae family, Anacardium oriental. And whenever you will miss, or whenever you think that this is a patient who is requiring lycopodium, who is requiring chelidonium, or who requires thuja, do give a thought to a remedy known as anacardium. Let us see what does this remedy have. Sudden loss of memory, everything seems to be in a dream. Patient is greatly troubled about his forgetfulness, confused and unfit for business. Disposed to be malicious, seems bent on wickedness. So you will have traits which are conveyed by the relatives. No patient is going to come and tell you that I am having malicious intent. When you will ask the relatives separately about the nature of the patient, they'll tell you that this person is hell bent on taking revenge. This person is hell bent on harming the other person anyhow. That is where you should think of a remedy known as anacardium. You can think of tarantula, you can think of all the malicious intent remedies. Anacardium will be such a remedy which will do the harm and also swear that I have not done it. So there is irresistible desire to curse and swear. You have other remedies which is laccan, lilium tigrinum, nitric acid, also similarly. And there will be stemonium who will even beg or try to please you. It's a false show from the stemonium person. Anacardium will do the harm, swear that he has not done. He may curse the opposite person, and he may not show that it is his intent to harm others, but he will harm and keep on harming. Next you have is opposite polarity, which is lack of confidence in himself or others. You saw one of the other polarities, which is forgetfulness, lack of confidence is over here. And another aspect you see is very lack of will, which you see. Feels though he has two wills, or he is always in a duality. Should I do this? Should I do that? And you will see many people, when you confirm this, you can actually ask the patients if they have this trait of uh, having two opinions whenever they want to choose anything. And chances are that they will tell you that yes, we feel that I should do this or that. Sometimes patients will tell you that I don't know whether I should do this or that. That is the stage of irresolution. but sometimes they will tell you that I am confused, I am having two thoughts, should I do this, should I do that. That is where you should think of anacardium as one of the top remedies. And you will see on the physical plane, this remedy has all the features of lycopodium, all the features of thuja. And wherever you get stuck up in a case of lycopodium and thuja, you should think of anacardium very strongly. Next you have is when walking in is anxious as if someone were pursuing him, suspects everything about him. Now this is a symptom which comes from the psychotic element, psychotic miasm in any remedy. And if you know that this is a psychotic trait, you will tend to remember all the remedies which are psychotic in nature. For example, metorhinum. One of the top remedies that you should think that has this symptom that someone is falling from behind. Next you have is hypochondriac. Anacardium patients are usually hypochondriac with hemorrhoids and constipation. They'll surf the internet, they'll meet different doctors, 100 people, they'll have gastric troubles which are minor or major in nature, but they will be very much worried and meet 100 people in their town. And last but not the least, in anacardium there is a very strange temper. He laughs at serious matters and is serious over laughable things. You will see this trait many times in your clinic. Whenever patient comes, he will start laughing. Whenever you ask him about mind symptoms, he starts laughing. We tend to overlook this and ask them about their mind symptoms still, forgetting that this was actually a mind symptom which they are presenting. And if you are a good observer, you will note down that particular behavior of the patient when he enters, or when you ask mind symptoms, when you ask physical generals, etc., and that pick up that symptom for repertorization or your analysis and give a remedy. Thinks yourself a demon, curses and swears. This is in the mind symptom of anacardium. Next you have is in the physical aspect, there is weakness of all the senses, sensation as of a hoop or band around the part. Cactus, carbolic acid and sulfur are the other remedies, as of a dull, blunt instrument pressing as of a plug in the inner parts. Headache is relieved by eating, entirely relieved by eating. In fact, that is the symptom mentioned. Another remedy is sorinum. When lying down in bed and when falling asleep, worse during motion and work. Gastric and nervous headaches of sedentary persons, urgentum nitricum, bryonia, nux vomica. So all those people who are working on a fixed job, sitting in their place for 6 hours, 8 hours, 12 hours, not moving much, if they are reporting to you with gastric troubles, think of the remedies which are sedentary in nature. Aloes, anacardium, nux vomica, you have podo, and all the remedies which cause portal circulation. In fact, you should also think of sulfur as one of the top remedies. Anacardium is apt to choke when eating and drinking. Cannabis sativa, kava is mentioned and nitric acid is mentioned. Swallows food and drinks hastily, symptoms disappear while eating. This can be a very important confirmatory symptom whenever you go into a case and you are asking about the peculiar two-will nature of anacardium, and patient tells that no, I don't have that, and you are trying to again and again confirm it. But the fact is that on the mental level you will not get much symptoms, whereas your physical level you will get some symptoms which are confirmatory. For example, better by eating, and that will always lead you to give a confirmation about the remedy rather than sticking on to mental symptoms which may be dependent on interpretation. I have been emphasizing on this, and if you realize that this is a very important aspect, mental symptoms, mind symptoms will be dependent on your interpretation. You will need to rely your prescriptions, base your prescriptions on the physical symptoms most of the times. That will give you enough power to prescribe the remedy also, because you can't change it. Mental symptoms are bound to interpretation, knowledge of the physician, and uh, how much you have studied from the different literatures and how well you have understood. So, physical symptoms in anacardium, symptoms disappear while eating. Other remedies are califos and sorinum. Stomach sensation as of a fasting, all gone, comes only when stomach is empty and is better by eating. Chelidonium iodum are another two remedies mentioned. Better during the process of digestion. Now this is such an important modality. If you have a pathological case which has GERD, which has duodenal ulcers, which has any pathology in the small intestine, and the patient feels better 1 hour or 2 hours after the after the food is taken, and he tells you that after eating immediately I don't find relief, but after 1 hour or after 2 hours I feel so good, as if I am, you know, feeling healthier in all aspects. I have cured few patients on this basis. That will be anacardium state. Better during the process of digestion. Once you understand it, you will never forget it. It is reverse of bryonia and nux vomica. Okay. Great desire for stool, but with the effort the desire passes away. With evacuation, rectum seems powerless, paralyzed with sensation as if plugged up. If there is irregular or overaction, that is nux vomica. If it is plugged up sensation and rectum does not have the energy to expel the contents out, it is anacardium. Skin, you have warts on the palms of the hands, and natramir is another remedy. If it is in the fingers, you know that it is causticum. It is also one of the bowel nosodes. You should go and read Bacillus 7 or Bacillus 10, I think so. So coming to an end for anacardium, it is a remedy which is related to Rus radicans, Rus tox, Rus venenata, and symptoms of anacardium are prone to go from right to left, which is lycopodium also for you. Interestingly, anacardium follows lycopodium and pulsatilla so well. And platina is another remedy which follows well anacardium, or anacardium can follow well platina as a remedy. So you have the mental symptoms of lyco, thuja, platina, etc., etc. in this remedy, and it is going to be a beautiful prescription if you have someone who feels better on the physical level or in the mind by eating. This is going to be very confirmatory for you. Don't forget this very interesting remedy, anacardium, and stay tuned for very good and interesting learning coming to you in few more days. So we finished today's session on Allen's keynotes, which is the remedy anacardium.